Hello, everyone, and welcome to our webinar. We are waiting a couple times, just people coming. I hope everything is okay. Yes. Hello again, everyone, and welcome to our webinar, Understanding Uber Health Transportation Support for Families with IDD. Today's session will last 1 hour, approximately. Our presenters are Charles, IDD Transportation Program Manager at OneWell Health Care, and Michael Jacobs from Uber Health Partnership Growth. Welcome again, everyone. And yeah, at the end of the webinar, we will have a Q&A seasons. So please feel free to ask your questions. We kindly ask you to use the chat to submit your questions, and our speakers will monitor the chat and respond to your questions during the sessions. And also, we will also share with all of you OneWell Healthcare social media accounts where you can follow updates and stay informed about upcoming events. Thank you for joining us, and let's get started with Charles.
Thank you, Delara. Hello, everyone. Welcome to our transportation webinar today. So I'm one of your speakers. My name is Charles Nightlinger, IDD Transportation Service Manager for OneWell. And I have Michael Jacobs from our Uber Health Partnership Growth. Michael will be joining us for this presentation and going over a little bit about what is Uber Health today. For this presentation, we're going to be reviewing what Uber Health is, how an individual can access it, and what the benefits are for the Uber Health program that Uber and OneWell has worked together to bring to our IDD individuals. Here at OneWell, we value person-centered care, ensuring the health and safety dignity of all the individuals that we cater to, making sure their plans are tailored to their unique needs, working with families, SCs, and other support professionals to ensure that the individual's needs are met. We always approach every case with compassion and empathy. Each individual is respected and guided with integrity. We strive for excellence with all of our individuals, holding high standards for not only our professionals, but the individuals that we provide services to, and continuous innovations, bringing these services and other needed services to our individuals to improve their care and quality of life. So one of the first topics that we're going to discuss in this webinar is the barriers that are faced by the IDD population when it comes to their transportation. For all of us that help support individuals with IDD, we understand that transportation can be a huge barrier for them. Insufficient coordination across different agencies and programs can lead to limited options for our individuals to access transportation. This limited access to healthcare providers leads to gaps in non-medical transportation, barriers with their employment, and social isolation and limited inclusion in their community. These can all lead to higher risk factors for those individuals. Not having means for transportation means whether they have employment or looking for employment, their employment is at risk if they don't have transportation to get to and from a location. A job that they strived and worked so hard to achieve, they could lose that job. Just like anyone here on this call, if you don't show up to work, your employment's in danger. The same for these individuals. Accessing their community. If any of us couldn't leave our homes, visit friends, families, go grocery shopping, it would have a major impact on our lives. The isolation can lead to depression, can lead to anxiety, can lead to a whole other slew of mental health problems for our individuals. by providing something as simple as transportation, which most of us can take for granted. We can leave our houses at any time. These individuals are dependent on somebody either providing transportation or having means to transportation to do daily errands, to visit their friends, to be social, to access their programs. We take these little things for granted, but they create a huge impact for those individuals. Some of the impacts that a lack of transportation can have is difficulty accessing daily supports, whether that, again, is visiting their friends, their families, supports groups that they like to attend so they can feel included and supported. Accessing their home safely if they don't have reliable transportation to get back home from activities. How do they get back home? That lack of transportation to employment, it can lead to them reducing available job offerings to them. It can reduce their ability to work in locations, pick up hours, increase their independence and the community engagement. If they can't access their community, they can't be part of it. I've worked as a DSP for several years in my career, and one of the biggest things that was always stressed is having that individual have access to community supports, being part and engaged in their community, because it helps build a secondary safety net for them. An individual that has access to their community builds routines, builds relationships in that community. That builds another safety net for them, an extra set of eyes. If one individual's daily routine is going to Starbucks and picking up a coffee every day, they build bonds with those individuals at that Starbucks. Those employees know that little John comes in every day to buy a large coffee, and he does that every day at 8:30. When he stops showing up for his daily coffee, people notice. But you can't form those relationships if you don't have access to those transportation options for them. So with Uber Health and OneWell's partnership, um, we're bringing benefits with simplified transportation. Um, the use of our systems with Uber have created a simplified version of Uber for individuals in the IDD community to access, making it easier for them to reach appointments, community programs, and supports, increasing their independence and building confidence in those individuals, giving them that access back to their community, with social engagements, strengthening those connections with friends, family, and their community, becoming an active member of their environment instead of being isolated at home. And then the retention for employment. By having access to reliable daily transportation, individuals can maintain their jobs. They can find new opportunities that may have not been accessible to them before due to distance or travel times. Uber fills in that barrier, where somebody can have access to a wider range of opportunities. So what does a typical week of transportation needs look for an individual? Most individuals, they're going to be working. They're going to go to a program. They're going to go anywhere between 1 to 5 days per week. From our data, that it shows that an average trip for an individual can be up to 14 miles per one-way trip. And that average trip can cost their standard transportation budgets up to $35 per one way. And this can include some out-of-pocket costs for that individual, whether it's accessing public transportation, and there's a copay, or they have to pay for bus tickets or other out-of-pocket costs for their standard transportation. So just looking at a model for 5 days going to work, and then you have to consider that they also have to have those return trips. So they're looking at 10 trips per week with an average round trip of 28 miles. This can lead to a weekly cost of $354 with an average out-of-pocket cost per week around $62. Now, that may not sound a lot to most people in this call, but for these individuals, they may have limited payment because they have to stick to certain regulations through their waiver. They can only make up to a certain amount. And when they're paying $62 a week to access public transport, that's essentially working to work. You're paying your transportation costs for the privilege of working. And that's not fair for a lot of individuals. They want to, have that little extra money so they can engage. They can feel fulfilled. They can feel accomplished, that they've worked towards something and they have something to show for it. And we don't want that money to go back into just providing them access to work. So with our partnership with Uber, we have seen a 30% reduction in the annual costs versus public transportation options for individuals through specialty transportations. This can be specialized vans, buses, other programs that are catered to around providing transportation to the IDD community. And a 30% reduction is incredible. There hasn't been a lot of different options presented to individuals over the years to have flexibility with their transportation. And one thing to keep in mind is with not only these annual costs decreasing, it's more time back for these individuals that's returned to them. An average bus trip, for a 10-minute ride, this individual could go 10 minutes down the road to their employment. That bus trip could easily be 30 to 40 minutes because that bus has to follow specific routes, has to make stops on the way, where an Uber can pick that individual up right at their home, take them to the destination, and that is time returned back to their daily lives. That's time for other activities, for other needs and supports that individual could have been missing out on because they had to dedicate it to transportation. And that transportation is not always reliable. If public transport's closed for whatever reason, that means that individual doesn't have access to their community, to their employment, to their day program. It's dependent on that. If that individual misses their designated pickup time at a bus stop, that bus isn't going to wait for that individual. That bus is going to arrive at 7 a.m. for pickup. It's going to pick up all the passengers waiting at that stop, and then it's going to move on to its next designated stop. That individual could be 5 minutes late getting to that bus stop and they miss their transportation for the day, or they have to wait an hour for the next public bus to come around. So in addition to those annual reductions in the costs associated with their waiver, you can't put a price on how much time is going back to that individual. So just for some cost comparisons between specialty public transportation costs, again, for an average trip of around 14 miles, which is on average the typical transportation for an individual for a one-way trip, we see through normal specialty transportation that trip can range around the $35 range, which is, again, $350 to $4 a week. And for a fiscal year, that can be $18,000 of their ODP waiver funding that's now allotted just for transportation. When we compare that to the cost that we see for Uber transportation through OneWell and the Uber Health program, we see that trip cost being reduced to an average of $29 per trip, with that equating to $290 per week with a $14,790 per year fiscal budget. That's a huge amount of savings just for the waiver itself. And this does not include the out-of-pocket costs. Again, some transportation providers require a copay for that individual to ride. That could be around $6 per trip, which is at $62 per week. And it doesn't sound like a lot, but when we put that into a full year of transportation, that's $3,000 that is coming out of that individual's pocket. Where Uber transportation, there are no out-of-pocket costs to that individual. Everything's being covered through their waiver. They're not required to pay anything additional to the transportation that they are receiving. This is a huge give back to the individuals utilizing the transportation. So OneWell solutions and how we're helping our individuals. OneWell's innovative approach to the services. Our services are set up for an individual and catered to their specific transportation need. We feel that every individual should have a plan put in place that is unique to them and their transportation needs. This includes identifying what locations an individual needs transportation to and from, how often that transportation is required, and setting up a plan through their waiver so they can have access to that transportation throughout the course of a fiscal year or however long that individual needs that transportation for. Our system will calculate budgets and travel costs for that individual. We communicate that information to that individual supports coordinator in the form of a service request that we provide, breaking down their funding costs, the units that they would need to add to their plan, and along with their service codes, and ensuring that they're fully aware of how much budget that they would require for that transportation service. Our comprehensive supports, we provide 24/7 back-end support here at OneWell. We feel that service should be accessible to all individuals regardless of their skill set. So whether they're fully independent and can access it all on their own or need that additional support, OneWell's here to provide that support to them so they have options available. It reduces the workload for the SC, the individuals and the families after the initial intake meeting and their app setup. The individual will be able to access their transportation and they're able to see their budgets listed in their OneWell app, so they always know how much money is left in their account to access their transportation. And they're able to track and monitor travel routes with their drivers along with the budgets that they have put in place. And continuous monitoring for all rides from the moment trips start to the moment trips end. Families, supports coordinators, individuals have access to track drivers to make sure that they're arriving to and from destinations safely and securely. And immediate notifications for families or relevant persons in case of need. That's another great thing about the service is we can set up multiple access to an individual's account. So whether a family member or supports person needs to have access to support them, they want to ensure that that individual is getting to and from their location safely, we can set up notifications through our system that will allow them to access the individual's account to ensure that they're arriving to and from their destination safely. So this was just a brief overview of our services as a whole. I will turn it over to Michael, who has a couple slides that he will present some information on what Uber Health is, what the program entails, and then how it is functioning as part of Uber.
Thank you so much, Charles. And thank you everyone else for having me and the entire OneWell team for inviting me in to speak with all of you. Been working with Charles for just over 2 years now, and the rest of the OneWell team, and it's been a great experience for me. It's been a great experience for Uber Health. So they invited me in to talk a little bit about Uber Health specifically, outside of just OneWell, but also applied to what they do and the services that they provide. All the time, I'm here in San Francisco, and I walk around and tell people that I work for Uber Health. Their first question is typically, "What is that?" Which is a fair question, especially with the Uber brand having so much notoriety and Uber Health not having as much. Back in 2018, Uber decided to leverage its network for good, primarily focused on what we consider access to care. So across the healthcare sector, different kinds of healthcare providers, they've always struggled with getting, whether it be patients or individuals, to and from care. And so why not leverage Uber's enormous network to ensure that they do? And so the main difference between Uber Health and core Uber, as Charles has alluded to, is that we work with organizations to ensure that patients and individuals get to the care they need. So I work with Charles directly in OneWell, and they leverage our network to ensure that people get to where they need to go. And the beauty of that, and what I found very meaningful, is that we're really only as impactful as our partners. Without the OneWell team, we aren't able to really become parts of these individuals' lives and get them to where they need to go, because this isn't something that we, as of right now, can stand up to individuals. I don't have the ability to engage with them directly and to offer them the level of a solution that OneWell offers directly. So we work with all kinds of healthcare organizations. I personally work with partners in behavioral health, oncology, dialysis, larger health centers, emergency departments, really all over the country. But among them as well would be considered non-medical transportation through OneWell. And so we serve all kinds of communities, what I would consider typically the most vulnerable of us, to ensure that they get to not only the care they need, but as Charles outlined, basically all of the other benefits of life that they deserve to be a part of. I worked a bit of time in the autism community doing ABA therapy at home, and when COVID hit, and some of these pro-social encounters and community involvement capabilities for individuals were taken, it was traumatic, as it was for many of us, and so it's nice to be able to give back and lead this partnership in ensuring that we can get people out in the community and to where they need to go. You can go to the next slide. I think would be a good place to jump. This is the second question I typically get around what's the difference between Uber Health and Uber. How's it different? How is it the same? I would say one difference is that we do have enhanced safety features. So on top of having OneWell's incredible team behind every ride, in terms of we have a 24-hour call center. They manage and facilitate these rides with individuals. They have their app, which is incredibly user friendly. We also do have slightly more rigorous background checks in the form of ensuring that they're qualified for these rides. It is a balance, considering that we also have the scale of Uber. So another question is, how can I get a ride, or is it available where I am? I think a good rule of thumb is if Uber is available where you are, Uber Health likely is too. We try and include as many of our drivers as possible, assuming that they meet our qualifications, in order for really to grant our individuals and patients and riders with autonomy, so that they can say, I want to be somewhere in 15 minutes, and there can be a car there in 5 minutes to pick them up. That's the goal. It's a level of service that most Uber users have grown accustomed to, and we want to be able to offer that to our health users. So striking the balance between making sure that every passenger is safe. We have safety features in the form of trackability for caregivers, loved ones. The OneWell team has visibility into every trip, as well as safety features if a car is stopped for more than a couple minutes. It alerts the individual, is everything okay? It can alert the caretaker. So you really do get an enhanced safety compared to pretty much any other mode of transportation outside of maybe personally transporting someone yourself. You can imagine that if someone takes the bus, maybe they have to switch over to a different route. You really don't have any guarantees on where they are, unless you're tracking them on their phone or whatnot. With Uber Health, you do have that peace of mind of being able to have that oversight and those safety features. And just for talking about scale, we have offered over 7 million trips in the last 12 months with Uber Health. So although it is a small team compared to Uber, we have a huge footprint, and you can imagine the need for people to get to and from care is enormous, and to engage with the community is even larger. So probably go to the next slide, Charles, and I'll make sure to hand it back to you. But to anyone who has questions toward the end for me and Charles, please don't hesitate to ask. Always happy to answer them. I've valued this partnership for the last 2 years. I don't want to pick favorites, but probably my favorite one of mine. So I'll hand it back to Charles to kind of go over some of the benefits of Uber Health and specifically how they translate to OneWell.
Yeah, thank you so much, Michael. One of the biggest things, as you mentioned, is that safety, knowing the individual's drivers are screened. That family and support staff have peace of mind that they know where the individual is. Because like you said, outside of directly transporting them or tracking them, maybe through their phone or another application, you don't really know where they could be on their transportation journey. They could be at a stop, a bus could break down. That bus driver is not contacting the supports team and letting them know that the bus broke down. They're just worried about getting that bus up and running again. So having that peace of mind is really key to a lot of families and a lot of individuals. A great example I like to use is recently I took a trip and I had to go by train. My train got canceled at a connecting station. And I started panicking. And I'm like, I don't know what train I need to go to next. There's no one around me to ask. I'm trying to figure it out on my phone, which train can get me to my destination. And I had a moment of realization, like, if it's this anxiety inducing for myself, if it's this difficult for me, how is somebody with IDD supposed to navigate this with no supports around? If their train is canceled, um, how are they going to know what connecting train or what connecting bus? How are they going to manage and get that support to get them to their destination instead of being stranded? So again, that safety and that dedicated support are there to help every individual, again, regardless of skill set. If they're fully independent, they still have access. If they need that support, it's there for them. The cost effectiveness we've covered. On average, we see a 30% reduction in an individual's waiver funding for those transportation budgets. The independence and freedom it grants individuals, it's giving them access to their communities back in their hands, their employment, to access locations as they need, long as it's identified as a need for the individual and put into their plan as an acceptable use of transportation. Those user-friendly experiences. They have the supports team there to help them. Um, the app itself will cover in another slide in this presentation, but it is a simplified app that makes it easy for scheduling rides. They have the access to their budget tracking, their social opportunities, increased employment, and community integration. The one kind of drawback to the transportation that we get a lot of questions about is accessible for medical appointments as well. And I do like to mention that the service through ODP itself is not intended for medical transportation, so to and from doctor's appointments, specialty appointments. Transportation to and from medical appointments typically goes through an outside program that's called MATP, which is Medical Assisted Transportation Programs, and this is typically done through an individual's insurance. Now, there are drawbacks to this program as well. It offers really cheap transportation to and from medical appointments, but there are some limitations to the program itself where an individual needs to go to a specialist and it's outside the range of this MATP. What do they do? How do they access that transportation? So for things that MATP could not cover, it is possible to have Uber transportations added to an individual's plan to supplement that MATP transportation to and from doctor's appointments. It does require their local county's approval to get this added as a service through their ODP funded waiver, but it is something that we can always assess for the individual. A lot of people are curious, how do I start this program? I've learned about it. I'm interested in it. Where do I begin? So for our waiver funded individuals, it starts as a simple referral. That individual supports coordinator can contact OneWell, inform us that they have an individual that would like to meet to discuss Uber transportation services, and we schedule a meeting with that individual and supports coordinator to discuss. That leads into that intake meeting where we discuss the transportation needs for that individual. Where do they need to go? How often do they need to go? Are they familiar with utilizing Ubers or other ride-sharing services? If not, we want to make sure that they feel comfortable. So during that intake, we will review all that information, start building a profile for that individual to access the transportation through Uber Health and OneWell. We provide the supports coordinator with everything that they need to do a critical revision to have that service added to their care plan. Once that SC has that information in their hands, they'll review it. They submit the critical revision to the county for approval, and then it's in the county's hands. A lot of people ask, okay, we've had our intake, can services start? Services typically take 2 weeks from that intake period for services to be approved. This is because counties have to review a service request when it's going through their waiver. They have to make sure the funding can fit within that waiver budget. It meets the needs for the individual. So typically 2 weeks after that intake meeting, where all the information is reviewed for the individual. Services are then either approved or denied in their plan. If approved, that individual would be able to activate their OneWell services with us. They'd be able to start scheduling rides from their approved start date for services. And in the meantime, while services are being approved, we make sure each individual or supports team member, family member have training on the app. They've downloaded the app, they can access it. Everything is up and running for them for that start date. Our OneWell app, as I mentioned, is kind of just a simplified version of what you would see utilizing the standard Uber app. Individuals accessing the app will have an option to either book for an immediate pickup, and as Michael said, on average, it can be anywhere from 5 minutes to, around 10 minutes for a driver, just depending on how far away a driver is to that individual. But the great thing is Uber system always is trying to locate the closest available driver to that individual, to that pickup destination, to ensure a quick and timely pickup. Individuals also have the ability to schedule their rides in advance. So our system allows them to go through book rides up to 30 calendar days in advance. And that way, if they have a reoccurring work schedule, they can go in, put in their work schedule, their transportation, and then it's set for them. They don't have to worry about waking up that morning and quickly trying to get ready and schedule that Uber to get them. They can have those rides preset for them. That way, once they go in, they just check to see what their who their driver is, what vehicle they're driving, and they go out to meet them. Our system allows for locations to be preset for those individuals. So each individual accessing the service will have a list of pre-authorized locations. That list will be labeled to whatever they like, whether it's something simple as home to work or labeling it as a specific address. We can set it up. That way they can go from their list, click on the corresponding trip that they want. And as you can see from the third screenshot of the app, you can see it outlines where the pickup destination is, where the drop-off destination is, the route that the driver will be following, the fare for the trip, and the distance. Once they've selected that location, they just review that that's what they want. Is that the correct pickup address, the correct drop-off address? Is the date and time they selected what they need, or are they booking for an immediate trip? Once they hit that approve ride after reviewing, that ride is submitted through OneWell system directly to Uber Health system to get in touch with that driver to get that ride picked up. And we do have a little testimonial from one of our users. They stated the OneWell app is amazing. It's easy to schedule my rides and track a driver. I can see where they are at all times. Everything I need is in the app. I just pick what I need and schedule it. It's much easier than other transportation services. And then we'd have a video presentation from one of our original members from Uber Transportation. Joseph Casson has been with OneWell Uber, has been with the OneWell Uber program almost from the very beginning. So he was kind enough to give us a video testimonial on his services. So we'll just go ahead and start that. Oh, why is my... Okay, maybe not. So I do apologize. It looks like the video link is not currently working. So my apologies. It was a very, very wonderful video, but we'll have to come back. And just another testimonial from one of our individuals. OneWell has changed my life. I used to worry about losing my job because of transportation, but now I have no worries. I can't imagine life without OneWell and the amazing people. I cannot imagine my life without the amazing people at OneWell. They're patient and always there for us. So this concludes our presentation on our Uber Transportation Service Program. If you do have any questions, you're always welcome to reach out to our main line at 1-855-720-9355. You can email us directly at info@onewell.org. If you visit our website, I believe my contact information, if you'd like to reach out to me directly, is also on our website. You can reach out to me directly if you have any specific questions, or if you'd like to make a referral, I'm always happy to assist. But for our presentation, we'll move over to a Q&A session. So I believe the chat is open. Delara, can you confirm that the chat's open for any questions at this time?
Yes, 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 Charles. We are waiting questions. Our chat available for everyone. And also I'm adding the chat section to our videos.
So I see Crystal Shell asked, what is the vetting process for drivers?
Sure. Yeah, I can take this one, Charles. That's okay.
Absolutely.
Yeah, so every U.S. driver undergoes a screening before their first trip. So this involves, motor vehicle record review, as well as any criminal history background checks. In addition, that's for Uber altogether. For Uber Health, they also receive checks for exclusion and debarment from federal and state healthcare programs. It's an OIG exclusion. So there's these additional screenings. I believe there's no prior criminal history, and these are recurring checks and screenings. So it's not just like you can become an Uber driver and you're good for life. You do have to go through these screenings recurringly.
And then I see David asked, how does this relate to mileage listed in an ISP? So if you're referring to mileage for a standard transportation service provider, such as the zoning, it doesn't relate to mileage. Uber Transportation's added into the plan as a per trip cost versus a mileage breakdown, seeing as the rates for an Uber ride are not just solely based on mileage, but time of the request, distance, availability. So it does break down differently than a standard transportation service that is added to the plan, and that is why the Uber transportation team provides the breakdown of the requested transportation to be submitted in the plan. We break down the cost per trips, the cost for the fiscal year, and the units that would be required for the duration of the transportation services.
Charles, I
Tracy
can take
asked,
Brandon's question. Oh, sorry, did I skip one?
yeah,
You go for daily mileage. Yeah, go for it.
Tracy asked, what is the daily mileage limit if it goes over that amount? So there is no hard cap on what mileage limit an individual will have. Again, it is based on what their transportation needs are. So when we do our intake meeting with an individual and discuss what transportation they need, we assess, how many trips per day do they need? That mileage is based on those number of required trips on a daily basis. So there is not an exact limit. Like if you have a limitation of 20 miles, you cannot exceed that. It is a little more fluid with that transportation because there can be fluctuations in mileage too if there's road closures, if alternate routes need to be accessed. It's more based on the actual daily limit of trips. So if you need 4 trips a day, that is how much the service should be utilized during that time frame.
Fantastic. I can answer Brandon's question. He asked, do Uber Health drivers get informed that they are working and transporting with individuals with disabilities? They do not. And you can imagine this is kind of a double-edged sword. So like I mentioned earlier, the primary focus of Uber Health is granting people access to care. It's often medical in nature or healthcare focused. And with that, we do protect our riders in terms of HIPAA compliance. So we do that in twofold. One, the information that is stored on the rider is held separately than the rest of Uber. So you can imagine in a case that nobody should know that someone is going to receive chemotherapy or going to receive some kind of treatment. Because OneWell leverages Uber Health, we have kept that information private from the driver. This can be, I understand a concern if a driver may not be prepared or trained in transporting someone with disabilities. We do, however, have kind of our overall rules of engagement and policies at Uber around inclusion. So there's no room for any driver to exclude providing services to individuals with disabilities. But it is worth noting that that information about the driver's identity is kept secret and is not disclosed to drivers.
Yeah, and I think that was the greatest point, like that HIPAA compliance, no driver has access to an individual's personal information, including their diagnoses. As that driver is not a member of that individual's direct support team, they would not have access to that information. Okay. Just making sure. I don't see any other questions in the chat. Are there any other questions that we can answer for anyone? Okay.
I think that's all.
Okay. Well, I do appreciate everyone that came out and joined us today. I believe Delara will have these videos also, these webinars archived. If anyone would like to share the videos, they're more than happy. They're more than welcome to access these videos. Delara, you can let them know where they'll be able to access them. But again, I want to say thank you to Michael for joining us today. I want to thank all of our attendees for joining us and being part of this presentation to really deep dive into what is Uber Health, how somebody can access this, and what it's able to support individuals with, because it's very important. As I mentioned before, having access to that transportation really breaks down barriers for individuals and provides more opportunities for growth and independence. So thank you so much for attending today, and I hope you all have a wonderful day.
Yeah. And if anyone, if there's someone who you think would benefit from this, feel free to let them know to join us next time. Happy to keep the conversation going and support who we can. Fantastic.
Thank you so much. Thank you everyone
Yeah,
for
thank you,
joining
everyone.
us today.